Hello, my name is Associate Professor Lauren Sanders. I'm a neurologist and headache specialist at St Vincents Hospital in Melbourne. So, migraine is a really disabling headache disorder, and people often will think of migraine as meaning I've got a bad headache, but it's actually a genetically determined disease. And in fact, it is one of the leading causes of disability worldwide and the number one cause of disability in women under the age of 50. So, it's a lot more prevalent than we think. And it's more than just a bad headache. It actually includes things like nausea, not being able to function. A lot of people will talk about brain fog, light sensitivity, sound sensitivity, and it's actually a really disabling disease when it's not treated appropriately. I was talking with a trainee about previous trainee about some work that he was doing with actually people in the military who have been exposed to blast exposure, so getting concussion and those kind of things, and getting headache afterwards. And we were saying, wouldn't it be great if we had some way of actually objectively measuring this? So in the past few years, in terms of migraine, we've started to understand that there's this molecule or peptide called calcitonin gene-related peptide, which is a bit of a mouthful. So we say CGRP. CGRP is really important in migraine. It's a messenger in the nervous system and it drives a lot of the migraine process. And what we now know is that if we can treat against that CGRP target with medication, we can treat migraine. And a lot of people are starting to benefit from that. But we don't fully understand the role of CGRP in migraine or other types of headache, like after a concussion or other headache diseases. And because we don't fully understand it, it means that we're not maximizing our best way of treating patients. And one of the problems with CGRP is that we don't have a great way to measure it. Globally, there's no standardized way of measuring CGRP. We don't actually know if we should be using blood or saliva or other ways of measuring it. So this project looks at, can we standardize and accurately detect CGRP in people with migraine and then test it in people without migraine to make sure we're measuring what we think we're measuring. And if we can do that, then we all of a sudden have a really valuable marker of migraine diagnosis, migraine disease activity, migraine treatment response, as well as further investigating headache diseases. I'm going to start with saying that migraine research is so important because it is such a disabling disease and it does get brushed under the carpet as it's just a headache. And it's really not. And most recently, the International Headache Society has put out a position statement saying we should really be targeting no disease activity like we would for multiple sclerosis or like we would target seizure freedom in epilepsy. Why are we still accepting headaches and disability in migraine? We should be treating tighter. What I would love to see as a result of this project is that we have a way to accurately measure CGRP in the clinical setting. So a person might come to me, they have a clinical diagnosis of migraine. I can do a blood test or test the saliva and say, yes, your CGRP level is elevated. Let's use a CGRP targeting medication. Or say, actually, your CGRP is not involved here. We need to think about other treatment strategies. Potentially down the track, we can then retest and say, yes, you are responding to the CGRP treatment because your levels are going lower, or you're not responding. We need to revisit this and think about other ways. So it has real potential for clinical benefit in helping to guide therapeutics for an individual person and not just kind of our best guess.